What's up, guys? Dr. John here. So don't mind my raspy voice. It might get a little raspier as I continue talking. So I really appreciate all of your questions yesterday and today. I'm going to go through a few of them. This one that we got from Flower Fave is a really good one. She asked about, can you suggest what's best for hyperpigmentation and some acne scars? Well, absolutely. So we have a wonderful thing for hyperpigmentation. That's our IPL. IPL is amazing because it breaks up all those reds and browns. Now, a lot of times with acne, after the acne heals, there's some leftover discoloration, and IPL is wonderful for that too. Now, one of the things that I love to use for acne scars, whether it's on the face, on the back, anywhere really, is Resurfix. It's fantastic. So Resurfix is our resurfacing laser. We also have CO2 laser. There's a little bit more downtime with that. Resurfix, you get a little bit of a sunburn, but you're right back at it. Usually 3 sessions for some deeper acne scars, but that's your best bet. It beats pretty much everything else on the market. All right, so we got another great question, and it's how do we approach natural filler for our patients? And that's a really great question. So I think the reason that our filler always looks natural is because we follow the anatomy that the person has already, right? So say you're doing cheek filler, I'm not going to make new angles for you. I'm going to follow the angles that you have and blend things so that it flows really beautifully. I'm not going to put filler in places that's not supposed to go, which will make you look like a person that's not a person anymore. So for instance, if you put filler here, sometimes that changes the way the face looks and it comes out and you look like a monkey person. That's not good, right? So we want you to look like you, just a little bit more enhanced and maybe lifted. As far as lips go, I think it's really it's all about looking at the ratios of the lips and how they play a part in how the ends of the lips here, the oral commissures play with the middle of your eye, and if I have to extend that out a little bit more for it to be in line, or bring this closer to the nose, the Cupid's bow, I think by enhancing that, it makes everybody look more feminine and younger. So these little things that if you have the soft hand and you really have a good eye, you can make things look super duper natural, and we do. All right, so next good question is, what's my favorite treatment to perform? That's a good one. I don't know, I like everything, but I think one that gets it's a big hit is the princess eye, and I guess the way that I inject and how tight I get around the eye, I'm able to turn the eye up a little bit like a Disney princess, and people dig that, so that's cool. All right, so another great question we got is, you run around a lot, Dr. John. What's your go-to IV bag? So that's a good one. I'd say I like NAD a lot. I did a NAD loading phase, which was really good. I had like 3 in a row or 4 in a row, I think. That was like super high amounts of NAD. I like happiness in a bag too. That makes me super happy. I like getting happiness in a bag when I get a hydrofacial. So that's called a Drip and Glow, by the way, and that's really great. But that would be the top one for me. All right, so another one was, what's my favorite treatment to get done? I think this is the Bio Repeal, the Glass Skin Glow. I kind of always mix that up. But Glass Skin Glow with Bio Repeal and hydrofacial and like the LED light, that's fantastic. I've been enjoying that a lot. So this one was asked by a couple of our staff members, because I think they're trying to embarrass me a little bit, but they asked me what's a phrase that I use a lot, and I think I say we went over this. I think I say loosey goosey, and I think I use that as a term for when I describe if the neck is a little bit loosey goosey. That's a good one. All right, guys. So that completes our questions. If you have any more great ones, if you want to know anything, just shoot us a DM. But we'll be doing these a lot in the future, so look forward to hearing from you.